Good afternoon, everybody. I'm Dr. Kelechi Williams Ulukwe. On behalf of the staff and management of HealthRite company, I want to welcome you all to today's meeting. And it promises to be an interesting one, and one that we all can gain something from. So I'm going to start. We're having two speakers today, and at the end of the introduction, I will welcome the first speaker for his presentation. I want to say a few things about HealthRite. HealthRite's vision is to be a national wellness and health service provider of choice, trusted by its customers, partners, and regulatory authorities for providing genuine and cost-effective healthcare services and products. Given the prevalence of chronic diseases such as diabetes, hypertension, obesity, to mention a few, HealthRite, being a one-stop wellness center whose focus is on the preventive medicine, was set up as a voice to make known the message of preventive medicine in Nigeria, Africa, and across the globe. HealthRite has professionals who are ready to follow you through your journey to wellness. Our medical and physiotherapy clinic offers you affordable professional services in diagnostics, treatments, and management of disease conditions at its best. The clinic also offers advice of lifestyle modification that can help speed up tissue regeneration and also reverse certain diseases as part of their services. It is important to note that one of the risk factors to most chronic diseases is a sedentary lifestyle. This is why our gym and its noble instructors are available to assist you in your routine workout and medically recommended workouts also. We also have a fresh bar, which is equipped with fresh and healthy meals and snack that can also aid you as you go on this lifestyle modification. It is said you are what you eat, and if you don't take care of your food, if you don't take your food like medicine, you would eat your medicine like food. This saying in our society has turned out to be a cliche, but it's not. It's also said that diet is responsible for 35 to 60% of cancer cases. This is a huge number, and it calls for serious attention. And I assure you that our fresh bar is out there to walk you through your diet modification. Ladies and gentlemen, I want to welcome you to HealthRite Company Nigeria Limited. Amongst these services I have listed here, we have other services also. And it will be interesting if you can come in and check us out. So without further ado, I want to welcome the first speaker for today, Dr. Nnemeka Okaro. He has a medical degree from Nigeria. He's a board-certified physician by the American Board of Internal Medicine, an attending internal medicine physician and hospitalist physician in Piedmont Hospital, Atlanta, Georgia. Ladies and gentlemen, I want to call up on Dr. Nnemeka Okaro for his presentation. Thank you.
Good afternoon, ladies and gentlemen, and welcome to this conference. So I will go ahead and start my presentation because I know time is of the essence. So today I'm going to talk about some of the common chronic diseases, starting with obesity, then hypertension, diabetes, stroke, and heart disease. So as we all know, chronic diseases are simply lifestyle diseases that once we develop them, we likely have to deal with them for at least 1 year or for the rest of our lives. But again, the good news is that there is help and treatment available. Most of these chronic diseases take a high toll in our lives. It can lead to disabilities like chronic pain, amputations. Most people that have chronic diseases are often unhappy for most of their life because they tend to spend a lot of their resources on hospitalizations, medications, dying pain. They become a burden to their loved ones, and often the person's lifespan is reduced. The question is, are chronic diseases preventable, managed better, or even reversed? And the answer is a big capital yes. Obesity is the #1 risk factor for chronic diseases. And for your reference, obesity is simply when your body mass index is 30 or greater. What is body mass index? That's your weight in kilogram divided by your height in meters squared. Recommended healthy weight is BMI 18.5 to 24.9. Overweight BMI 25 to 29.9. Anything above 30 is obesity. So as mentioned before, obesity is a risk factor for coronary artery disease, diabetes mellitus type 2, hypertension, stroke, chronic kidney disease, sleep apnea, even infertility in both men and women, blood clots, and clots in your lungs. Treatment for obesity includes #1, healthy diet. Simply means diet rich in fruits, vegetables, low-calorie diet. We recommend you engage in aerobic exercise 5 times a week, at least 30 minutes to 60 minutes each time. Try to lose 5 to 10% of your body mass index. If all this fails, then you can consult your physician for some supervised medications. On extreme cases, there is surgery available. We are going to move ahead to talk about hypertension. Simple definition by American Heart Association is blood pressure greater than 130/80, average reading taken on 2 occasions after 5 minutes rest. Of course, normal blood pressure is 120/80. So once your blood pressure starts going above 120, before it hits 130, it's pre-hypertension. And you're very high risk for becoming hypertensive if you do nothing about it. Risk factors for developing hypertension. Again, #1 is obesity. 2, sedentary lifestyle. 3, family history. 4, age more than 40 years. Unfortunately, hypertension is much higher in Black people. That includes most of us. Smoking also increases our risk of hypertension, just like psychosocial stress, and diet that is deficient in fruits and vegetables. and high in salt. What are the symptoms of hypertension? Very important point. Most of the time, there are no symptoms of hypertension. So how do you find out you have high blood pressure? By checking your blood pressure with your physician at least once a year from age 40 onwards. You can actually start to check it from age 30 if you have higher risk factors like family history or obesity. Some people do experience headaches, dizziness, nosebleed, or vision changes when their blood pressure is very high. The main complications of hypertension, which is why we have to do something and treat it, includes stroke, heart attack, heart failure, developing chronic kidney disease, and end-stage kidney disease that might require dialysis, and vision loss from hypertensive retinopathy. So what can you do about hypertension? First things first, you have to lose weight. You have to start an exercise program. Stop smoking. Moderate your alcohol intake, which simply means if you're a lady, 1 drink a day, that is 1 glass of wine, 2 small cups of beer. If you're a man, 2 drinks a day. Then change your diet. Eat food that is rich in fruits, vegetables, and low in saturated fat and cholesterol. If you need more help, then talk to your physician to start drug therapy. There are different classes of drugs. So let's move on to diabetes mellitus. Most of this talk will focus on diabetes mellitus type 2, which is the type commonly caused by obesity. Often type 1 is genetic or autoimmune and starts before age 30. Type 2 is the one that most people developed after age 30. And what is diabetes? Diabetes is simply you fast for 8 hours overnight. So don't eat from, say, 11 p.m. until 7 a.m. the next morning. Check your blood sugar by your physician. And that fasting blood sugar is more than 126 milligrams per DL. Another nice way to diagnose diabetes is to have your doctor check your hemoglobin A1C level, which simply tells you your average glucose level over the last 2 to 3 months. And according to WHO and the American Diabetes Association, once your hemoglobin A1C is more than 6.5 or 6.5, you have diabetes. Then you also have the oral glucose tolerance test, which we often do for pregnant ladies. At 2 hours after doing the test, if the sugar is more than 200, the person is diabetic. Some people unfortunately end up in hospital with symptoms of high blood glucose that includes feeling very tasty, having a dry mouth, passing a lot of urine, weight loss, and most of the time their blood sugar random is more than 200. That also means that person is now diabetic. Brief mention pre-diabetes. If your fasting blood sugar is between 100 and 125, you have a condition called pre-diabetes. And that simply means you have to take action because you are very, very high risk of becoming diabetic if you do nothing about it. So we recommend once you're up to 45 years of age, see your physician every year check your fasting blood sugar. But remember, if you have a strong family history of diabetes, or you are morbidly obese, which is BMI more than 40, from age 30 years, check your fasting blood sugar annually with your doctor. What are the symptoms of diabetes? Most people will have dry mouth. They're very tasty all the time. They drink a lot of water. And take note, they eat a lot of food. We call it polyphagia. And despite eating all this food, the person will still be losing weight. Some people will have some sores or ulcers in their foot or other parts of their body that refuse to heal. For females, often we have a lot of yeast infection in their private area. So why do you have to do something about diabetes? Because if you don't, you develop what we call microvascular or macrovascular complications. Most of these complications happen anywhere from 5 to 15 years after you develop diabetes. But mind you, most people with type 2 diabetes do not seek help or don't know they have it until after 5 to 10 years. The microvascular complications include developing chronic kidney disease and maybe end-stage renal disease, and you might end up in dialysis or require a kidney transplant if it's available to you. Developing neuropathy. Neuropathy is nerve damage. So you have a lot of pains in your feet, in your arms. Also developing damage to the vessels in your eyes that can cause blindness. So that's why it's very important you also see your eye specialist every year once we diagnose you with diabetes. The other major complications includes heart disease, developing angina or heart attack, peripheral vascular disease. This is the one that often leads to amputations, ulcers that refuse to heal. And then strokes is a major one. So how do you treat diabetes? Definitely, you need to have a good alliance with your physician and your healthcare providers in treating diabetes because it's very difficult to treat. Things you can do on your own is try to lose some weight by starting an exercise program, change your diet. Again, eat a diet rich in fiber, fruits, vegetables. Moderate your alcohol intake. And remember, once you start treating diabetes, you have to check your blood sugar at least once a day. If you are very motivated, check it up to 3 to 4 times a day. Keep your fasting blood sugar anywhere between 90 to 130 and your hemoglobin A1C less than 7. With this, you will reduce your risk of developing the complications I talked about. If all this fails, there are several medications your healthcare provider can start you on. And if the medications fail to control your diabetes, of course, we have insulin available. Let's move on to stroke. This one is the scary topic because it often leads to permanent damage and disability for the rest of our lives. So what is stroke? Stroke is simply when we develop a sudden focal neurological syndrome from disease of our brain blood vessels. And there are two main types of stroke. The common one is due to reducing the blood flow to a part of our brain. That's the one the doctors call ischemic stroke. It's responsible for 87% of strokes. The other type is the hemorrhagic, the one the people describe as bleeding into their brain, or some people will say blood vessel burst in their brain. That comprises 13% of strokes. And what are the symptoms of stroke? How do you recognize someone is having stroke? Like your parents, your siblings, yourself. You might notice the person's speech is slurred. Their speech is no longer clear. The person might say, oh, they can't swallow. They try to drink water, they feel like they're choking. The person might notice one of their arms or legs is feeling weak, weaker than the other one. It can actually be both legs or all the four limbs. Some people will tell you, oh, they feel numb, or they feel like pins, needles on one part of their body, on their face. You may notice the person's mouth feels twisted. We call it facial droop. Especially elderly people will tell you, oh, they feel dizzy and they lost their balance when they walk. They feel like they want to fall. Then some people may be confused. So what can you do to prevent developing a stroke? A lot you can do. Number one, healthy diet. Number two, exercise. I can't overemphasize the benefits of these two things: healthy diet, exercise. Other things you can do is control your blood pressure if you have hypertension. If you develop diabetes, control your blood sugar. If your cholesterol level is high, bring it down. If you are a smoker, today is the day to decide to quit smoking, because smoking increases your risk of stroke very, very high. Of course, if you have sleep apnea from your obesity, which you might know because you snore a lot, or you wake up in the middle of your sleep fighting for breath, or you wake up in the morning, you don't feel rested, consult your physician, treat your sleep apnea. Also, if you have irregular heartbeats, do something about it. There are medications to control these things. How do you treat stroke? So once a stroke happens, the goal of therapy is to quickly reduce the damage to the brain as much as possible. We do this by measures to improve perfusion, in other words, to improve blood flow to that part of the brain that has reduced blood flow, so that the damage to that part of the brain will be reduced. First line medication is, of course, aspirin and Plavix. If the person does not have the hemorrhagic stroke, that is, if the person does not have bleeding inside their brain, and the only way you know that is by getting a CT scan of the MRI or MRI of the brain. It has to be done immediately. We actually recommend within 60 minutes of onset of symptoms. Another thing you can do at that point is control the person's blood pressure, control their blood sugar, because if you don't, of course, they will likely have more strokes. Because once you have one stroke and you do not modify your risk, you are prone to having more and having more disabilities. Some of us may have heard about the so-called clotbusters. Yes, they are very good in limiting brain damage once we are having a stroke. Example, the so-called TPA or altiplase. This has to be given by your physician or emergency room physician or neurologist, but they've been shown to open up the blood vessels, increase blood flow to your brain, and reduce the damage. Unfortunately, stroke causes a lot of disabilities, a lot. Some of us will end up paralyzed in one half of our body. Some of us will end up having trouble to swallow. Some of us will end up having trouble to speak. Some of us will end up being in coma or totally paralyzed. At that point, what we do is what we call the supportive therapy. That includes physical therapy, of course, exercise therapy, occupational therapy, speech therapy. So let's quickly move on to heart disease. Heart disease is a very large topic, and I know it's of interest to a lot of us. We're going to break it down to number one, coronary artery disease, which is a disease of the arteries around the heart. That's when we develop plaques or cholesterol buildup inside the arteries in our heart. And that's the one that gives us those chest pain, angina, or heart attack. Then you have the congestive heart failure, which is simply the heart has failed as a pump. We all know that the heart pumps blood throughout the body. So when the heart is weak, it cannot perform this function. Then you have the irregular heartbeats or the arrhythmias, which if you develop can give you strokes. Then you have the damage to the heart valves, which can be from infections. And some of them are congenital heart disease, which are the ones we are born with, like the holes in the heart. Coronary artery disease. So this is the type of heart disease, again, that gives you chest pain and heart attacks. And what puts you at risk of developing coronary artery disease? Unfortunately, we have the non-modifiable risk. Those are the things that you cannot really change, like being a man, having a family history of premature coronary artery disease, which means heart disease that developed in a man before age 55 or female before age 65. Because you know, you say the estrogen at times protects the young females. So you can't really do anything about being a man more than 55 years or female more than 65. But you can do something about other factors that can make you develop heart disease, like hyperlipidemia, that is high cholesterol, high triglyceride, like smoking. Some of us may wonder why smoking. Smoking, again, is a very, very, very high risk factor for heart disease, strokes, high blood pressure, because the chemical in the smoke damages the inner lining of our blood vessels. And that's what is the problem. Another risk factor you can modify is your lifestyle. If you live a sedentary lifestyle, change it today, and that will reduce your risk of heart disease or heart attack. Other things you can do to avoid developing heart disease: manage your hypertension, because again, constant high blood pressure damages the inner lining of your blood vessels. So you develop more plaque, and then your blood vessels will block. And that's how you get a heart attack or develop chest pains. Manage your diabetes, very important. if you have obesity problem, lose weight today. Again, moderate your alcohol intake, reduce your stress level, change your diet. If you do drugs like cocaine, stop it. So how do you know you're having a heart attack or angina? So the symptoms are you have chest pain, typically on the left side of your chest or in the middle of your chest. Most people will say the pain radiates to their shoulder, but it may not. Then you might have the pain actually in your jaw or in your arm, common in females or elderly. Also, females can also develop, even males, just feeling of indigestion. Other symptoms include difficulty to breathe after you exert yourself, like you take a short walk. Often when people are having an acute heart attack, you notice the person will start to sweat a lot. They can start to have nausea, vomiting, fast heartbeat. Elderly person might just be weak. So how do you make the diagnosis? I know this is for physicians, but for knowledge purposes, you need to get a 12-lead EKG start. Then, of course, the cardiac enzymes, cardiac CT, MRI, echocardiogram, or cardiac catheterization. So once you develop this coronary artery disease, these are things you can do to help yourself. So under treatment, what can you do? You modify your risk by changing your diet today. Eat a diet rich in fruits, in vegetables. Start an exercise program. Lose that weight that you've been putting away from losing year after year. 2021 is the year. We know it's tough to stop smoking, but you have to make up your mind. Say, yes, I want to. Stop smoking. There is help. There are professionals ready to help you stop smoking. Again, I can't overemphasize. Control your blood pressure. Control your blood sugar, your diabetes. Manage your cholesterol. Apart from this, we have so-called angina medications. There are several of them, like beta blockers, nitrates. Another thing that we do is the cardiac catheterization, which is very good because your cardiologist can look direct into your arteries and clean up the arteries or put a stent to open up the arteries of your heart. So let's move on to another topic on the heart again, congestive heart failure. That's simply pump failure of the heart. Commonest cause, surprisingly, is again coronary artery disease. Other causes include hypertension, valvular heart diseases, congenital heart diseases, and cardiomyopathies. Cardiomyopathy is just enlarged heart, like caused by alcohol. So how do you know you are maybe developing congestive heart failure? If you notice you start to have this unusual cough, often productive of clear sputum. If you notice you start to develop swelling in your legs, you can go ahead to involve your abdomen, your whole body. If you notice you feel short of breath, you have to sleep with 2 or more pillows to feel comfortable. If you are gaining weight, feeling weak, see your physician today. Of course, for physicians in the audience, 2D echo, again, remains the gold standard for diagnosis. How do you treat congestive heart failure? Common things you can do is to restrict your fluid, reduce your salt, but you really need to partner with your healthcare provider to treat this disease. So
Hello, Dr. Emeka.
hello.
Can you still see the slide?
Yes. Treatment of congestion. So again, you can reduce your fluid intake to 1.5 liters a day. Cut down the salt in your diet to less than 4 grams total salt a day. Then there are several medications. The main one is the so-called AC inhibitors, ARB, beta blockers, diuretics. Of course, if you have heart failure,
Go ahead.
if your heart failure is not able to be controlled with all this, then heart transplant is the only option you have. So I would like to thank everyone for listening. I hope we can all make changes to our lifestyle today.
Thank you so much, Dr. Nameka Okaro, for that wonderful presentation. We're going to entertain questions. We're going to have a questions session at the end of the second presentation. So I would love us to drop our questions in the chat session. We can drop our questions. I don't know if I'm audible enough. Can you hear me?
Yes, I can hear you.
Okay.
Yes,
Perfect.
I can.
So let's drop our questions. Anyone who has a question should drop the questions at the chat section. We'll pick up questions. We already have 2 questions that has come in, so we'll take care of the questions at the end of the second presentation. So I would love to welcome the second speaker for the day, Dr. Uchenna Anekoni. She is a public health physician and the founder of HealthRite Company Limited, a one-stop wellness center in Lekki, Nigeria. She has a medical degree and a master of public health degree in Nigeria. She's a member of the American College of Lifestyle Medicine, the Infection Prevention and Control Canada, and the Nigerian Medical Association. Ladies and gentlemen, let's now make welcome Dr. Uche Anekoni for her presentation.
Thank you very much, Dr. Ibukwe. I want to say thank you to all who have joined us, and let's go there. My own topic is lifestyle medicine, how we can use it to take care of so many of these things that Dr. Nemeka has already mentioned. Of course, he mentioned that there are a lot of things that are modifiable. So this is where lifestyle medicine comes in. And this is very important because it has been proven by evidence-based studies that people who actually do this well are able to prevent, because this program is not for only people who are sick. So people who have done this well have been able to prevent and even reverse some of these diseases. So what are we going to learn? We have heard a lot about the early signs of chronic diseases. We have heard the disadvantages of not taking care of them. Now, what to do? So let's go there. Now, all these things that we heard from Dr. Emeka is pretty alarming. It's an alarming health problem the world over. The World Health Organization says that 80% of heart diseases, stroke and type 2 diabetes, and 40% of cancers could be prevented primarily, that's in the beginning, with improvements to diet and lifestyle. 80% of heart disease, stroke, and type 2 diabetes can be prevented if you improve your diet and lifestyle. Why are we not doing it? Then the American College of Lifestyle Medicine also says 85% of chronic diseases today are caused by unhealthy lifestyle choices. 85%. All those horrible diseases and all the medications that you need, and sometimes surgery, you can actually prevent them. Why are we not doing it? In Nigeria, chronic diseases are not even taken seriously at all. They are neither prevented nor managed well due to lack of knowledge and poor resources. This is according to a study by HealthRite Nigeria. Okay, facing the facts. If you can see my footnotes, I got this document from a WHO publication. So it's about the impact of chronic diseases in Nigeria. Let's start from Nigeria because I know a lot of my audience are from Nigeria. Chronic diseases are the major cause of death and disability worldwide. In Nigeria, chronic diseases are projected to account for 24% of all deaths. This is in 2005. The WHO projected that over the next 10 years, over 5 million people will die from a chronic disease, 2005 to 2015. That was a projection. I tell you, we met that projection. So when scientists do studies, they're not just talking from their mouths. They actually have evidence to show that when they're making projections, it could be right. And yes, this projection was made in 2005, and we actually passed it. Deaths from chronic diseases will increase by 24%. Most markedly, that's the shocking one, deaths from diabetes will increase by 52%. I hope you are as shocked as I am. Okay, now preventing chronic diseases, why should we even do that? It's a vital investment. It's a vital investment for every one of us individually, but it's even a more vital investment for the country. This WHO document that I was talking about noted that chronic diseases create large adverse and underappreciated economic effects on families, communities, and countries. In 2005 alone, it was estimated that Nigeria lost $400 million in national income from premature deaths due to heart disease, stroke, and diabetes. These losses were projected to continue to increase cumulatively, right? So from 2005 to 2015, Nigeria lost $8 billion just from premature deaths due to heart disease, stroke, and diabetes. Why are we just talking in dollars? Because the WHO compares different countries. So they use a currency that is comparable. So if we put this in Naira, well, you know what that is, okay? Now, they recommended solutions. They don't just put out a document or a report or just do studies for doing sake. After the studies, solutions were recommended by the WHO for Nigeria. We're talking about the Nigerian data now, right? So in these solutions, they mentioned that at least 80% of premature heart disease, stroke, and type 2 diabetes, and 40% of cancer, I'm repeating it, could be prevented through healthy diets, regular physical activity, and avoidance of tobacco products. I'm repeating this is verbatim from the recommendation by the WHO for Nigeria. They said cost-effective interventions exist and have worked in many countries. The most successful strategies have employed a range of population-wide approaches combined with interventions for individuals. So the WHO estimated that 2% annual reduction in chronic disease death rates in Nigeria will result in an economic gain of $500 million for the country over the next 10 years. Now, this is a pretty old report. As I said, it's from 2005. So I looked for something current. Well, you can see the website that I got it from, but this was in 2019. So speaking during the official flag off of the National Multi-Sectoral Action Plan for the prevention and control of non-communicable diseases for the country. On 6 August 2019, the Permanent Secretary, Federal Ministry of Health, said NCDs are the major cause of disease and death globally. In Nigeria, research by WHO in 2018 shows NCD prevalence to stand at 29%. So it's increased, it actually increased from the projected 24%, is now up to 29%. Incidentally, this same document also said the deaths stand at 29% too, and the cardiovascular diseases at 11%, cancer 4%, and diabetes 2%. Well, this is what we have online. We are not certain that this data represents Nigeria because we don't even know how many people do go to the hospital, right? So let's look at the people that have data that might be representative. So this one is chronic disease in the US. I know some people are logging in from outside the country. So chronic disease in the US is showing in this infographic, which is a bit horrifying. I'm sorry, let me just go back there. 6 in 10 Americans have one chronic disease. 4 in 10 Americans have 2 or more chronic diseases. 38% of Americans will be diagnosed with cancer during their lifetime. Half of all Americans have cardiovascular disease. 1 in 3 Americans have prediabetes. This is horrible. 88 million people, 88 million Americans have prediabetes. 90% do not know it. 90% of these 88 million people do not know that they have prediabetes. Well, for the people that know, some people are already living with type 2 diabetes, and that's 34 million people. Now, 72% of Americans with overweight or obesity. This is crazy. And this information, at least we are very certain that they do not manufacture their information. They are saying the fact based on the studies they have done. It's crazy. I got this. This is the most recent infographic from the American College of Lifestyle Medicine. Okay, now, the problem we have in the world today is that we are still managing chronic diseases. In fact, we have gotten so well at managing these chronic diseases. We have gotten so well, so much new curative knowledge, so many surgical techniques, so much technology out there to keep us alive. But many people are still not living happily. They are managing. So treatment for many diseases have been discovered, but many chronic diseases are yet to be conquered by drugs and all the technology and surgical techniques till date. We are managing hypertension, we are managing diabetes, high cholesterol, heart diseases with medications. And these people keep taking these medications and they never stop. Some people have a bag of drugs that they need to take. Why should we get to this when we can prevent it? And incidentally, what we are learning from the American College of Lifestyle Medicine is that you can even reverse them. You can even reverse them. Now, let's just look at a document from the American College of Cardiology and American Heart Association. Well, they stated in this report that we can see here, 2.1, if you are really interested, we can send you the slides, you can look at where we got it from. So the 2.1 in the report says lifestyle as a foundation for ASCVD risk reduction efforts. So many doctors are trying to go back to the drawing board. The important thing is that we are not waiting for our clients to get sick. Even when they have gotten sick, we want to teach them how to get themselves back to normal, if possible. Well, for people who are interested in this exercise, I have this little calculator here. You can actually calculate your cardiovascular risk by yourself. But the important thing that I hope everybody heard in all this is that the major cross of most of these chronic diseases is to start with lifestyle. If you listen to Emeka, you would have heard almost in all the slides, once the factors are modifiable, you always start with lifestyle. Okay, this is the 6 pillars of lifestyle medicine. I know people will be asking, what is even lifestyle medicine? Lifestyle medicine is here. It used to be said that it's in the future, but it's right here with us. It's now a thing in medicine. Lifestyle medicine is an evidence-based approach to preventing, treating, and even reversing diseases by replacing unhealthy behaviors with positive ones, such as eating healthfully, being physically active, managing stress, avoiding risky substances, adequate sleep, and having a strong support system. Yeah, it's a thing now. And you'll be surprised that many of your doctors are now pioneering lifestyle medicine. In these 6 pillars, so many people have heard it, most of them actually. In fact, I think a lot of people already know all this. They know they should increase their physical activity, how many people are doing it. They know they should develop strategies to manage stress. Some people don't even know how to do that. They know, okay, a lot of people don't know much about the healthful eating because there are so many recommendations on eating healthfully out there that people are confused. So if you come to a lifestyle medicine practitioner, I think he will be able to point you to the right direction, because what we are recommending, which has been shown to reverse diseases, some of these diseases, some people who already have it. I'm talking about American data now. Some people who already have it were able to reverse it. So that means that we actually saw proof that they had this disease, and they were followed up over a while with this lifestyle medicine practice, and they were able to go disease-free. I have actually seen them. So it's kind of like proven. But some of the things that they're asked to do might seem so simple, like all this, they seem so simple, but the difficulty is that we have formed so many bad habits that it's difficult for us to move on. For instance, you tell people that they need to move on to whole food, plant-based foods, right? When we say whole, we mean minimally processed. And when we say plant-based, we want most of your food to be plants. And if possible, remove as much animal protein as you can, as much as you can. That's the one that is hard for people. I know that I have a client that when I told him that he's so bad, he had hypertension, he had diabetes, and he had prostate cancer. And I said, the way your results are looking, I think I need you to go to the end of the spectrum, because we have a spectrum when we're making recommendations for people. You don't just ask people to jump to the extreme, right? To start from maybe you don't just come in and tell somebody you have to stop all the meat you eat, right? Is a spectrum we normally have. So when I told the person, you need to get to the end of the spectrum, people like you have actually been able to reverse these diseases by going to the end of the spectrum. His response was, you know what, if I stop eating meat and I stop eating fish, what is left in life? So that's why some people will have to just keep managing. But what we say is that any amount, any little you can do shows some improvement. I'll give an example. I have a client during Lent, right? He was able to, by himself, to stop eating meat for the whole period of Lent, right? And he was also doing a little bit of fasting. And it's crazy. Within 1 month, what the difference was in his health. It's crazy. I wasn't the one that recommended he should stop eating meat, but it is crazy. It's now left to know what will happen after Lent when he goes back to that normal, right? So the very first thing that you can do to help yourself in chronic disease management is to seek for knowledge. People have half-baked knowledge. Now I'm telling you about the American College of Lifestyle Medicine. It means that there are physicians who actually are trained in this. So so that you'll be sure you're not getting your information from the streets or from Dr. Google. So you seek for knowledge. And these physicians normally are at the apex of the program. They are supported by other clinicians who are not even doctors. So they are supported by it could be exercise physiologists. They are supported by dietitians. It's a whole teamwork to get you on track. Okay, the very first thing to do is to create a goal. And when you're creating a goal, everybody knows that the goal has to be SMART. It has to be specific. It has to be achievable. It has to be measurable. And of course, it has to be realistic and time bound. A lot of people come when you show them the spectrum, because we show you the spectrum. We expect that you should start, everybody should be able to start with the DASH diet. The DASH diet is actually a clinical diet that was developed for hypertension. Everybody should be able to start with the DASH diet because it doesn't limit so many things, right? It reduces your salt. I think a lot of people are learning that salt is not just the salt, the table salt. You have salt from your seasonings. So the DASH diet limits your salt. It increases your fruits and vegetables. You can still have some of your animal protein. So we are expecting that most people should definitely be able to start with the DASH diet. It actually helps people a lot. And then as you go along, depending on your motivation and what you can do, because we always say we meet people where they are. What you can do and what you can fit into your lifestyle will help you to develop a plan, that will be achievable. And of course, discipline is so very important to keep to the plan. If you don't have the discipline, well, I think it's something that is difficult because you might have to continue taking your drugs. Very, very importantly, you don't do this on your own. Consult and follow your doctor's directives. And we do have doctors in HealthRite, but we can also work with people who have their doctors in different locations. It's very, very important. We recommend that if you have something like blood pressure, you should be able to have a monitor at home. People think it's expensive, but it might be the cost of your wristwatch. If you are wearing a wristwatch now, this blood pressure monitor might be about the cost of a wristwatch. I know we have some at HealthRite, and I know the prices. You need a weighing scale. It's so cheap. In fact, they sell it along the road. It's so cheap. It's something that people should have at home so that they will even know when they're adding weight. A lot of people don't know. Of course, very, very important is to join a support group of individuals with similar goals. And yeah, this is something we also do at HealthRite. And we have a group for people. If you're not interested in allowing other people to see your contacts, you can also join our broadcast list. In the broadcast list, you don't see anybody's contact, right? You just have to save our number. If you save our number, it will prompt us. You save our number, send us a message. So anytime we'll share something on the WhatsApp group, we will share it. It will come personally to you. It won't involve being in a group. So these are some of the things we need to know, the lifestyle choices that we in our health today. We need to know our health numbers, what to do and how to do them for maximal benefits, the health data from our country and the world, and important evidence-based success stories that show how to prevent, manage, and even reverse illnesses. The source of this information is very important, as I just said. Okay. Now, at HealthRite Chronic Disease Prevention Management and Lifestyle Switch Program, we have this kind of like a mantra. Is a saying by Maya Angelou: do the best you can until you know better. When you know better, do better. You just have to do the best you can. A lot of people think they already know so much about lifestyle medicine. They already think they know what to do, but you just need to keep learning. Every day you learn new things. So this program has been designed by a team of experienced medical doctors, dietitians, physiotherapists, and exercise physiologists. This program is aimed at providing the relevant information, tools, and support needed to live a healthy, active life. Okay, so what the target is those already living with existing chronic diseases like diabetes, obesity, hypertension, to help them manage the disease, or if they can go to this end of the spectrum, they can even manage to reverse some of these diseases. Of course, very importantly, those who do not have any diseases, but they are at risk of having it, maybe they have family history of diabetes, it's early. It's time to start early so that you prevent it. And there are just people who just want to avoid. They don't have any family history, but are just interested in avoiding and preventing chronic disease. We provide this program in our state-of-the-art facility in Lekki. And we also have a virtual program for people living outside Lagos. Now, this is an infographic. Well, we can't digest all this, but definitely those who registered will send it to their emails if they request for it. But it's kind of like an action plan. Like you already heard Dr. Emeka say, you can start with the goal of walking 30 minutes, five days a week. Of course, improve your quality of sleep. All right, so this is something that we can send and share with people if they request for it. Okay. And this is our WhatsApp number. For those who do not want to join a group, we just want to get on the broadcast list. If you save this number on your phone, you can now send us a message. Just say hi, and then we can be sending you the messages that we are sharing with people on the group. Okay, thank you very much. And question time. Dr. Ibukwe, I believe you already have questions from the...
Yes, thank you so very much, Dr. Uche. We have two questions already, like I stated, from some of our registered audience. The first question: can I have a follow-up with my doctor outside Nigeria through HealthRite without traveling to the US, and how does it work? That's the first question.
Okay, thank you very much for that question. I'm assuming the person that asked this question already has a doctor and maybe had a little challenge traveling. Yes, we have a telemedicine facility in HealthRite. So we'll be able to help you connect your doctor if you can get the name of the doctor. And we also have doctors in the US who might be able to also help you out if you're interested. Yes. So you first of all have to contact us at HealthRite, and then we'll give you the details of how it works. Thank you.
Thank you very much. The second question: can you please let me know why I must be taking BP medications, like blood pressure medications?
Wow. Okay. So this is another great question. My assumption is that you have been placed on this medication by your doctor. So for that reason, I will encourage you to continue your medication. and start the lifestyle, all the lifestyle modifications that you can do. However, as you're on those medications, if you improve your lifestyle, your doctor will start to see the changes, and the doctor will be the one who will make those changes in your medications. Obviously, that's for instance, if a doctor sees his client that he has put on medications for diabetes and the blood sugar is going so low, he will not leave it like that, right? But BP medications, very important, because it's a silent disease. Because it's a silent disease, people don't know they have it. They need to be on it until their doctor says so. In fact, what we learned in medicine is that once you have high blood pressure, you probably will be taking your medications for life. That's what we learned. For now, because people are not able to do the whole spectrum of the lifestyle medicine, most people are not able to do the whole spectrum. So for that reason, we don't take people off their medications. It's your doctor that will see if your BP is going so low. And he finds out, because a lot of people think, oh, my BP is now okay. But most times it is the medications that is making the BP okay. So for that reason, we don't just take you off. We just need to, we need to continue with your medications and allow your doctor to make that decision. Of course, we have doctors in HealthRite who can help you make that decision. Maybe Dr. Emeka can add more to this.
Yes, I can. I agree with all you said. So to the person that asked the question, yes, you need to continue taking your blood pressure medication, because if you don't, that your blood pressure that is normal today will become high once you stop. Actually, some medications, immediately you stop them, your blood pressure shoots up. And what may happen next, you won't like, because you might end up getting a stroke. You might end up getting what we call a mini stroke. You might end up getting a heart attack. Because remember, high blood pressure damages the lining of your blood vessels. You may end up going into heart failure. You can also develop some peripheral artery disease. Another thing I will mention to you, if you're having some side effects from these medications, and that's the reason why you wonder, should you continue them? Please talk to your doctor. Medications, as we all know, have side effects. And there are things your doctor can do to minimize the side effects, or your doctor can also change your medication to a different kind of medication. But again, do not stop the medicine on your own. Talk to your healthcare provider. And just to reiterate, so once you do the lifestyle changes and your blood pressure comes down nicely, of course, your physician will be very proud of you. We all will be. And then your physician will safely take you off the medications, slowly but surely. Thank you.
Thank you very much.
We have a third question. I think this question is directed to Dr. Emeka. What is the impact of high blood pressure medication to the body? Then he asks further, when the cause of hypercholesterol is in the family line, how do you manage it? That's when it's genetic.
So thank you for that question. High blood pressure medications fall into several classes. Of course, the common one is the so-called diuretic. That's the one we start with as physicians. So the impact on the body depends on what medication you are taking and how much you are taking and your body chemistry or your genes. How is your body responding to it? So I will mention a few to you. Again, most of us start managing our blood pressure by taking diuretics from our physician. Diuretics act by making you to increase salt or sodium output from your kidney. So some people that take high blood pressure medicine can develop what we call hyponatremia, whereby the salt level in their body is low, their potassium level might go low, their magnesium level might go low. So when these electrolytes are low in your body, you may have some symptoms, which might include you feel weak, you have nausea, you have headaches. Again, your doctor can always change you to something else like calcium channel blocker. Calcium channel blocker, the impact it has on most of us is swelling in our legs. So it's better tolerated. I know for the young males in the audience, I've had patients that complain that when they take their blood pressure medicine, their blood pressure falls. They develop what they call ED, that we hear a lot in television these days, erectile dysfunction. So that's another impact of some of these blood pressure medicines. At times, diuretics are associated more with developing erectile dysfunction than the other medications. So again, if you have any of the side effects, don't feel ashamed or feel shy. Talk to your healthcare provider, talk to your physician. These medications can be changed. Even if it's ED, you feel like you can't perform, you can't satisfy a woman before, we have several medications for it.
Thank you very much, Doctor.
Okay, I'll just add something. The second part of the question that says where the cause of cholesterol is in the family line, how do you manage it? This cholesterol thing is something that we can hit with a big hammer in lifestyle medicine. It's one that is easily managed with diet and lifestyle. So high cholesterol, yes, a lot of people take medications for it, but you can easily manage that one more. This is not saying you should stop your medications. It's your doctor that will stop the medications when he or she sees where you have gotten to. Yeah, thank you very much.
Thank you very much, Dr. Uche. There's a question to Dr. Okaro. Is cholesterol a danger to the body as a unit? Every cell in the body makes cholesterol. 80% of the circulating cholesterol is from the liver. Vitamin D and all the hormones are made from cholesterol. So the question is cholesterol a danger to the body as a unit?
Thank you for that excellent question. Yes, we all have cholesterol in our body. Most of our hormones are made from cholesterol and other lipids. But the danger is this: when the cholesterol in your body becomes too high, then there will be what we call plaque buildup inside your arteries, and that's the problem. We go with, I can give you a number to that. When your total cholesterol is more than 200 milligrams per DL, that's when it becomes a danger to your body, because you're going to now start building up more plaque inside your arteries. And with time, with years, this plaque will get bigger and bigger and will be blocking the blood flow through your arteries. And that's what causes these diseases. And then one day, if you're unlucky, one of these plaques will do what we call rupture and can occlude the artery complete. And that's what gives you the stroke. That's what gives you the heart attack. And that's what gives you the peripheral artery disease, leading to amputations. So the answer to your question, yes, there are different kinds of cholesterol also. Good cholesterol is good. Cholesterol is good in moderation. So that's why you need to check your cholesterol level. You know, there are different kinds. The total cholesterol, the triglyceride, LDL, very low LDL, the lipoproteins. So you need to check your levels. And if it's at an unacceptable level, then you have to take action to bring it down. Thank you for that excellent question.
One last question. I think this is an interesting one. Does HealthRite have the capacity to test for pre-diabetes? If not, which options are available with us?
This is a no-brainer. I should even be asking you to answer that question. Yes, you can do.
Yes, we do have the capacity to do so.
Okay. So you can easily do your HbA1c. That gives you a 3-month picture, right? Maybe Dr. Emeka can corroborate. Yeah, HbA1c is a 3-month picture we are getting, right?
Yeah, we can get that.
I agree with you 100%.
Okay.
For the person that asked the question, even if you have checked it outside, remember, if your fasting blood sugar is between 100 to 125, you are pre-diabetic already. If your A1C is between 5.6 to 6.4, you have fallen into pre-diabetes category. So time to get help. Thank you.
Okay, thank you very much. And I want to ask somebody from the HealthRite conference room to give us a vote of thanks. And while we are waiting, we also want to say everyone who registered for this event to get will just send us a message to get the slides. Thank you.
Once more, it's been an insightful webinar. I want to thank everyone that have been part of this. It's a journey, and I believe with the information we have presently, we can do better. Just like a group from Maya that are teaching showed one of our slides. Now we know better, we can do better. I want to thank Dr. Unemeka for taking our time to take us on the journey. Thank you very much, Dr. Uche. Thank you, Dr. Kalechi, as well. And every one of us who have been part of this, thank you very much for HealthRite. Thank you.
Okay, thank you very much. We appreciate you all. And yeah, you can still contact us. If there are any questions, you can send it to admin@healthritenig.com. admin@healthritenig.com. Of course, the people who registered already have the link where they can send us questions. Thank you, everyone, and have a beautiful evening or morning for those who are in this part of the world.